Hello everyone. Today we're going to talk about a rather sensitive, yet extremely important topic for men's health, especially as we get older. It's the impact of daily masturbation on the prostate gland. You might be thinking, how could masturbation affect my health? But in reality, it's not just a simple personal habit. According to research and health experts, this behavior can actually have significant effects on the body, particularly the prostate, a vital organ that many people tend to overlook. In today's video, we'll explore 3 basic physiological mechanisms triggered by frequent masturbation and explain why this matters especially for men over the age of 40. I'll also share with you some real-life stories and expert insights to help you understand how to maintain prostate health without unnecessary worry. We won't dive into complicated medical jargon. Instead, we'll break things down into clear, easy-to-understand information, so you can take care of your health in a simple and effective way. Let's get started. Let's begin with a simple look at the prostate. The prostate is a small gland, about the size of a walnut, located just beneath your bladder. Though small, it plays a crucial role in producing the fluid that nourishes and transports sperm. It also influences sexual function, urination, and comfort in the pelvic region. When we're young, the prostate usually works just fine, with no need for concern. But as we enter middle age and beyond, the prostate begins to change. One of the most common issues is prostate enlargement, also known as BPH, benign prostatic hyperplasia. This condition can lead to symptoms such as frequent nighttime urination, difficulty starting urination, or the feeling of incomplete emptying, significantly affecting daily life. Aside from enlargement, the prostate can also suffer from inflammation or blockage if not properly cared for. And don't forget, the prostate tends to lose elasticity with age, making it harder to stay healthy over time. So, why is prostate care so important? Because it affects not only sexual function but also your overall well-being, especially as you grow older. Interestingly, very few people know that maintaining a regular, balanced sexual routine can actually help keep your prostate healthy and reduce related risks. Now that we understand the prostate a bit better, let's move on to the 3 key physiological mechanisms that daily masturbation influences. Let's dive in. Now, let's explore the biological mechanisms inside the body that are activated when you masturbate daily. You may be wondering, does this really have an impact on my body? The answer is yes, and we're going to break down the 3 main ways that daily masturbation affects the prostate. First, during orgasm, a crucial hormone in your body called DHT, dihydrotestosterone, temporarily decreases. DHT supports male characteristics but is also linked to prostate enlargement. When DHT levels stay elevated for too long, it can overstimulate the prostate, leading to unhealthy growth. Masturbation creates short resting periods for DHT stimulation, allowing the prostate to relax, reducing the risk of enlargement. Next, ejaculation causes the muscles in your pelvic area and around the prostate to contract. These movements don't just help release fluids, they also boost blood circulation, delivering nutrients to the prostate. Good circulation helps keep the prostate tissues supple and flexible, preventing stiffness or blockage. However, if these muscles are overstimulated without enough rest, it can cause pelvic fatigue or discomfort, leading to symptoms like urinary difficulty or heaviness in the lower abdomen. Finally, the prostate has its own localized immune system, which helps eliminate dead cells and biological waste through ejaculation. This is a natural defense that helps prevent chronic inflammation and supports prostate health. But if there's not enough recovery time between ejaculations, this immune system can become overstimulated, resulting in low-grade inflammation that feels uncomfortable, even if medical tests don't show anything serious. As you can see, daily masturbation does have certain physiological and immune-related effects on the prostate. But the key is balance. Without proper rest and recovery, these natural mechanisms can turn into long-term problems. Now that you understand the science, let's continue with a real-life story about a man who experienced these issues and how he improved his prostate health. Let's listen to David's story. Now, let's take a look at a real-life case from one of my former patients, to better understand what can happen when we neglect our prostate health. David, 65 years old. Used to be a very healthy man. He worked in the construction industry his whole life and maintained an active lifestyle. However, in recent years, David began experiencing strange health issues he couldn't explain. He noticed frequent nighttime urination, a lingering sense of incomplete emptying after using the bathroom, and persistent discomfort in his lower abdomen. At first, David didn't think much of it. He assumed it was just part of aging. But as the symptoms worsened and started affecting his quality of life, he finally decided to see a doctor. When we conducted an ultrasound of his prostate, we discovered that his prostate was mildly enlarged. His PSA levels, prostate-specific antigen, were elevated, and the tissue showed signs of mild, uneven inflammation. After talking with David, I learned that he had completely stopped all forms of ejaculation for nearly 10 years, including intimacy with his partner. He believed that after age 55, these things no longer mattered. Plus, he felt embarrassed discussing it, so he ignored his body's needs. After our discussion, we decided to try a simple approach. He began making gentle lifestyle changes, light physical exercise, drinking more water, and adding prostate-supportive foods to his diet. Most importantly, we encouraged him to resume masturbation, aiming for 1 to 2 times per week depending on how his body felt. Just 4 months later, the results were impressive. His PSA levels had slightly decreased, nighttime urination had significantly improved, and the discomfort in his lower abdomen had nearly disappeared. Most encouraging of all, David no longer felt ashamed talking about sexual health. He felt more confident and, as he put it, "I never imagined something so simple could change both my body and my mindset this much." David's story is not unusual. Many men between the ages of 50 and 70 go through the same experience, either neglecting their prostate health or not knowing how to maintain it properly. But the key lesson here is, you don't have to wait until a problem arises to take action. Just like overall health, your prostate needs daily care and attention. With a few small adjustments in your daily routine, you can help your prostate stay strong and lower the risk of sexual and urinary issues. So now, let's move on to the next big question. How often should you masturbate? Depending on your age and health condition? Let's hear what the experts have to say in the next section. Now you might be asking, so how often should I masturbate each week to keep my prostate healthy without harming my body? The answer isn't one size fits all. It depends on your age, overall health, and how well your body recovers. To give you a clearer picture, we'll use general guidelines recommended by urology experts. Based on age groups, men aged 40 to 49. At this age, prostate health is typically stable, and hormone levels are still strong. Masturbating 3 to 4 times per week is considered ideal. It supports blood flow and helps relieve tension in the prostate without overwhelming the body. Your recovery ability is still good, so this frequency is usually well tolerated. Men aged 50 to 59. As you enter your 50s, your body starts undergoing more noticeable changes. The prostate may begin to enlarge slightly, and hormone levels may shift. That's why a moderate frequency of 2 to 3 times per week is more appropriate. If you feel fatigued or uncomfortable afterward, or start noticing symptoms like urinary difficulty, reduce the frequency to allow more recovery time. Men aged 60 and above. At this stage, sexual health may not be as robust, and the prostate is more prone to change. Masturbating once a week, or twice at most, is generally enough, provided you still feel healthy and interested. This gentle pace keeps the prostate functioning without creating strain or fatigue. But don't push yourself. Listen to your body. Most importantly, always listen to your body. Everyone's recovery ability is different, and masturbation isn't something that should feel like a chore. If you experience fatigue, discomfort, or warning signs that your body needs rest, don't hesitate to reduce the frequency. Aside from frequency, make sure you're also getting enough sleep, eating a balanced diet, and doing light exercise to support overall prostate health. Now that we've looked at physical guidelines, let's talk about another major factor that often gets overlooked: the psychological and social side of prostate health. We've covered physical factors and how often to masturbate, but there's another crucial area: mental and emotional health, and how it affects your prostate and sexual habits. As you might know, many men, especially older men, feel ashamed or embarrassed to talk about sexual health, especially topics like masturbation or prostate concerns. One big reason people avoid these discussions is social stigma. Society often sets strange expectations about what's acceptable for older adults. And topics like masturbation or midlife sexuality are rarely talked about. This creates a sense of isolation, shame, and discomfort when dealing with prostate-related issues. But in reality, masturbation after age 50 is completely normal, and it can play an important role in maintaining both prostate and overall health. What matters most is changing how we think about it. Caring for your prostate isn't just about the physical side, it's also about mental well-being. When men feel confident and comfortable taking care of themselves, they're more likely to stick to healthy habits and speak up when something feels off. In addition, this discomfort often keeps men from seeking medical support. They may feel too embarrassed to go to the doctor or to mention symptoms like frequent urination, trouble starting urination, or discomfort in the lower abdomen. But these are important early signs, and you shouldn't ignore them. Don't let shame stop you from getting help. Your health is worth far more. And talking about it can ease your anxiety and improve your outcome. Remember, prostate care and sexual health are essential parts of maintaining a high quality of life as you age. Developing a healthy, open mindset about these topics can boost both your confidence and your overall wellness. So we've now covered the most important factors that affect prostate health: physiological, behavioral, and psychological. To wrap things up, I want to leave you with one key message. Always listen to your body. Pay attention, take care of yourself, and never feel ashamed to talk about these topics or seek professional help when needed. Your prostate health deserves the care and attention it needs. Thank you so much for watching until the end. If you found this information helpful, don't forget to like, share, and subscribe to this channel for more valuable health videos. Remember, health has no age limit, and there's always something you can do to take better care of yourself every single day.